introduction, Mr. Hari Menon. Welcome, gentlemen. I'd like to now request the Joint Secretary in the Ministry of Tribal Affairs, Dr. Nalojit Kapoor, to please make a presentation on Ministry's Tribal Health Action Plan.
Good afternoon, everybody. Due to unforeseen circumstances, Honorable Tribal Minister and Honorable Minister of Health and Family Welfare, they couldn't join. So both of them, they have joined virtually. So as we all know, as far as the tribals are concerned, the tribal health issues are totally different from general population. Due to their remoteness, their unique practices and culture, genetic issues, when we examine the disease burden, we find that tribals have more issues pertaining to respiratory diseases, blood diseases, vector-borne diseases, TB, malaria, tetanus, fever, and very few lifestyle diseases. When we also talk about the status of health infrastructure in tribal areas, we see that there are still large gaps in respect of primary health center and community health centers. There are 40 districts which are not yet saturated as per the relaxed norm of Ministry of Health. 774 areas don't have PSCs, and there is shortage of more than 100 CHCs. When we talk about the funds, there is no dearth of funds as far as the tribal health is concerned. As you can see, more than 4,000 crores of rupees are spent by Ministry of Health. Then we have Ministry of Ayush, and Ministry of Tribal Affairs also have different interventions, and approximately 250 crore rupees is spent every year on tribal welfare. Other than this, as per scheduled tribe component, all the ministries, they are required to spend a dedicated amount on tribal welfare. So likewise, Ministry of IT, Ministry of Skill Development, and every ministry, they spend a dedicated amount on tribal welfare, and approximately 50,000 crores of rupees is spent on tribal welfare. As far as the health initiatives of the ministries are concerned, we have different schemes under which we fund the tribal health. As all of us know, there was an expert committee which gave a report in 2018, and in recommendation of the health committee, there were 4 or 5 major issues as far as tribal health is concerned. One of them was lack of tribal health data. So in last 1.5 years, not only based on NFHS surveys, we have prepared a compendium of 177 tribal health districts which we are going to launch today. We have also developed the Swasthya portal with the help of Piramal, and in respect of 177 tribal health districts, we have data not only in respect of health infrastructure but also availability of doctors, prevalence of diseases. Another recommendation of expert committee was that there has to be a focused governance structures for tribal health. We have initiated a tribal health action plan, tribal district plan for tuberculosis. Today we are also proposing launch of tribal health cell and national council on tribal health, which will create a dedicated mechanism for collaboration not only among the various ministries but also between government and non-government organizations. Another recommendation of committee was mainstreaming of tribal healers and tribal medicines and their indigenous practices and bringing them in the mainstream. So today we have with us Director AIMS, and we have also given many projects to various center of excellences who are working on tribal identification of tribal healers. In last 1.5 years, we have identified more than 4,000 tribal healers, and now we are designing curriculum and to bring them in mainstream. We have also collaboration with QCI, who will be registering them, and the tribal areas, there are a lot of indigenous plants. We are also validating them through NIPER and other organizations. Another recommendation of expert committee was regarding sickle cell disease. As you know, this is a disease which is prevalent among tribals, and more than 15 lakh tribals, they are affected with this disease. Based on these recommendations and based on our learnings in last few years, in 2020 we had prepared a tribal health action plan. As you can see in the first column, in tribal health action plan, the most important part is saturation of tribal areas with PHCs and CHCs. So this is foremost priority in health action plan. Then, as you know, due to the remoteness, large number of PHCs and CHCs that do not have doctors. So we have developed various models. So one of them was Satellite Center for Tribal Health and Research. Director Ames, sir, they have already in Sirohi experimented this, and we are planning that this model can be replicated in other areas. And similarly, as far as the tribal healers are concerned, how they can be brought into mainstream. Thirdly, telemedicine, because of remoteness, is one such area which needs to be explored. Today with us is sir, and we will request him, Dr. Paul, that the new policy on telemedicine, how interministerial collaboration and looking in mind the tribal areas, remoteness, how telemedicine center can play an important role. Collaboration with non-government organizations. We have today collaboration with more than 50 NGOs and partners like Piramal. And today we are also planning to launch this tribal health collaborative, which is also part of this tribal health action plan. These are the collaborations with different ministries where WCD, Skill Development, Ministry of Health, MITI, they will be partners in this tribal health collaborative. I'll not go into the details of detailed health action plan, but as you can see, Ministry of Health and Family Welfare, we plan to establish about 350 PHCs and 93 CHCs. Then through Ayush also tribal PHCs, and then validation of traditional medicines through Ayush. Then role of MOTA and Ministry of Skill Development in these training of these tribal healers. So these are the roles of various ministries. So after this tribal health action plan was developed, this was shared with NITI, Ministry of Health and all the state governments. As you can see, 8 state governments, they have given detailed requirements which can be taken up during PIPs this year. So Honorable Minister has also written to all the state governments, and Secretary has written to Chief Secretaries that when we are making plans for tribal health this year, then all these considerations should be taken into account. Next and foremost is launch of National Tribal Health Council. So because there are multi-stakeholders in this, so we have proposed that Minister of Tribal Affairs, Minister of Health, they will be the co-chair, and Secretary Health, Secretary MOTA and Secretary Ayush, they will be part of the committee. Then we have also requested Honorable Member Niti Aayog to be part of this committee, and civil society representatives, so that we can have a detailed action plan under Tribal Health Collaborative. What today we plan to do, I'll summarize the next 1.5 year roadmap. If we can establish 500 PSCs and 100 CHCs in tribal deficient areas during PIPs, launch of 19 June, as all of you know, is a sickle cell day. If we can launch the plan on 19 June for sickle cell, then integration of 5,000 tribal healers with the health system, since training modules and curriculum has already been developed by our different partners. Then we have about 740 EMRSs which will be coming in next 2 years. and there is a very good internet connectivity which will be there. So we propose that if we can establish telemedicine centers there, as AIIMS has done in Sirohi in one of the EMRSs. So next would be 50 institutions, satellite centers. If we can ask medical colleges, AIIMS and other private colleges, some of the colleges, they have also shown interest in this area. The health cell will monitor the tribal health plan, and since large number of non-government organization is there, and under Piramal Foundation and Bill Melinda Gates Foundation, they have taken a lead for this collaborative. So our request will be that rather than there being a scattered funds available, we are proposing that there should be a tribal health fund where all those non-government and other organizations who have CSR or corporate money available, or if many of them they are already working in tribal areas, if we can pool these funds so that there is an integrated and comprehensive approach for tribal health collaborative. We propose that 2 meetings at least should be there of this tribal health council, so that they can monitor and guide the different stakeholders of the tribal health action plan. With these few words, I'll just once again thank all of you, because most of you have come from outside Delhi also, and despite COVID being there, I'm very, very grateful that your gestures for coming here and being part of this initiative. Thank you once again.
Thank you very much, Mr. Kapoor. Ladies and gentlemen, to understand the complexities that tribal health involves, we have with us 2 experts who will make presentations, and I'll invite them one by one. First, I'd like to request Dr. Sanjeev Mishra, Director, AIIMS Jodhpur, to tell us more about the integration of tribal healers and the satellite center.
Good evening. Respected Dr. Harshvardhan, Honorable Minister of Health and Family Welfare, Shri Arjun Mundaji, Honorable Minister of Tribal Affairs, Dr. Subramaniam, Professor Paul, Mr. Piramal, Mr. Menon, all the dignitaries on and off stage, and the experts attending this tribal meeting. So we'll just present you a brief overview of what we have been doing at AIIMS Jodhpur with the Ministry of Tribal Affairs about the integration of tribal leaders and the satellite center which the Ministry of Tribal Affairs is there. So AIIMS Jodhpur with the Ministry of Tribal Affairs was designated as a center of excellence for tribal health. And we had 3 things in it defined: tribal healers, looking at them and what are their indigenous practices; the satellite center for tribal health and research; and MITR, a tribal telemedicine center at Sirohi. So we picked up Sirohi district, which is one of the aspirational districts designated by the NITI Aayog, and it's a tribal, predominantly tribal-driven district, and the area which is, we have taken up Abu Road and Mount Abu and Sirohi. It's around 150 kilometers from Jodhpur. And we started working with the tribal healers and looking at the indigenous practice, and our aim was to study the knowledge, attitude and the practice of these tribal healers about the prevalent diseases in the tribal community and the Sirohi district. So this was what we had started. And the action plan was, first we defined all the tribal healers in the aspirational district Sirohi, then identify the genuine tribal healers, then document their tribal and traditional practices, and prepare a module of training document for tribal healers, and then list the genuine tribal healers to the Quality Council of India, there working with the Ministry of Tribal Affairs. So we were able to identify nearly 1,000 tribal healers, and they are commonly called as Gopal in the traditional language there. And of them, 108 tribal healers practice some kind of traditional healing or herbal-based practice, while 90% practice what is called as a jhar phunk or where you can say exorcism, but then 108 we could really define and say that these are genuine tribal healers in some form. And they were doing some 30 traditional practices for different diseases which were identified. And then now we'll be working on developing a module which is the pictorial presentations or gamification for training of these healers for capacity building and quality improvement. So we wanted to work with them and be a part of the system, whatever they're trying to take good practices from them and also introduce good practices from our side also to them. And we are also working with the Ministry of Tribal Affairs to bring the listing of these tribal healers to the Quality Council of India. And this is just our team with Siroi, which is working with the tribal healers. And the second was the Satellite Center for Tribal Health and Research, which was in Abu Road, Tehsil, in the district of Siroi. So we all know Mount Abu, it's associated with the Brahmakumaris and so many things. So Abu Road is a place just before Mount Abu. And this was the first of its kind to provide quality health services and research activity dedicated to the tribal area in an aspirational district, mentored and facilitated by the All India Institute of Medical Sciences at Jodhpur. And this was a tribal-centric need-based research to focus on the health needs and well-being of the locals. A unique opportunity for training and exposure for healthcare workers of health, about the health status of the tribal, because this is also an opportunity for us, being a tertiary center, to go out into the fields and public and work with the and expose our doctors to these tribal problems which is there at their side. And also to provide quality health services to tribal areas and active data collection about health issues with actionable objectives. So there was this Bhavan, or which we have taken the Ministry of Tribal Affairs, where we are running this satellite center. And the satellite center, we are looking from communicable to non-communicable diseases which are there, common being tuberculosis, silicosis, skin, sickle cell disease, which we have heard, maternal and child health issues, anemia and other nutritional deficiencies and non-communicable diseases, and also about addiction, alcohol, tobacco and other addictions. Then we also launched what is called as a tribal telemedicine center. We called it as Mitra, managing illness using telemedicine for tribal in remote areas. We were working on a hybrid model, and we picked up a CHC where these people could come there, and our doctors from Jodhpur, we had a dedicated time where we would be giving telemedicine consultation to them. So the common problem that we saw were general medicine issues, dermatology, pediatrics, and these are the three commonest things that we were seeing and giving consultation. And from November 2020 till 18th March 20, we have done around 226 teleconsultations, and all are referred from the CHC at the Abu Road. And as Dr. Kapoor said, that this experience, what we are gathering from District Siroi, we should be able to have it all across the country in different places where tertiary institutions come forward and be part of running these tribal organizations and work with the tribal healers, and so that it's part of the mainstream healthcare. And this model satellite center for tribal health and research district can be replicated in other tribal areas also. And inaccessible tribal areas can be made accessible through the telemedicine facility, which is not difficult with the country being going digital more than in a very big way. So this is where we stand at the All India Institute of Medical Sciences, working with the Ministry of Tribal Affairs, and thank you for giving this opportunity.